Hi everyone, today I'll be discussing Chapter 3, Social and Racial Considerations for Health, from Current and Emerging Rural Healthcare Issues in Southeast United States. This chapter focuses on how social and racial factors influence healthcare outcomes in rural communities. I'll summarize the key points from the chapter and connect it to rural healthcare themes in community health and health equity. Chapter 3 explains how social and racial conditions strongly affect health outcomes in rural populations. The chapter emphasizes that healthcare access is influenced by more than hospitals or clinics. Factors such as poverty, education, transportation, employment, housing, and discrimination all contribute to these health outcomes. The chapter also discusses how racial and ethnic minorities living in rural areas often experience worse health outcomes due to limited healthcare resources and systematic inequalities. One of the chapter's central ideas is that social determinants of health shape healthcare outcomes in rural areas. Rural residents are more likely to face poverty, unemployment, and limited transportation options. These barriers make it difficult for individuals to access preventative services, specialties, and emergency care. Education also affects health literacy and the ability to understand healthcare information. The chapter highlights that racial and ethnic minorities in rural health areas are often experience greater health inequalities than white populations. Hispanic, Black, and Native American communities have a lower insurance coverage rate and reduced access to healthcare providers. According to Huang and his colleagues, he found that social capital and public trust influence healthcare coverage and participation among Hispanic populations. This chapter strongly connects to the course theme of community health and health equality. Community health focuses on improving the well-being of the entire population, especially vulnerable groups. Health equality means ensuring everyone has fair opportunities to achieve good health regardless of race, income, or location. Michelle Bishop explains that residential segregation influences access to education, employment, and healthcare resources. In conclusion, Chapter 3 emphasizes that social and racial considerations play a major role in rural health outcomes. Rural populations, especially minority groups, continue to face barriers related to poverty, access to health insurance, transportation, and discrimination. Through policy changes, community partnerships, and cultural competent care, healthcare organizations can reduce the disparities and improve overall health outcomes. And then these are the resources that I used for this presentation.